Here are the top 5 mistakes that I typically see with grammar when it comes to the OET writing. Here we go. Number 1. This has to do with the use of the verb presented when we're talking about a patient coming into the office. Typically, what I see is the patient presents with symptoms of fatigue and sore throat. The problem with that is by the time you're writing the letter, the patient has already come into the office with those symptoms. Therefore, instead of the patient presents with present simple, we actually need presented with past simple because that event has already occurred. The reason that's complicated and an easy mistake to make is because of the word today. So don't be deceived by time phrases. We want to think about when did this event happen? Has it already occurred? Mistake number 2 that I typically see is not using the passive when it is needed. By passive, I mean the structure of was and then the verb in the participle form. So was advised, was recommended, was prescribed. The passive is a complicated structure, and in order to think about when to use it correctly, we have to think about who is actually doing the action. So for example, this is what I commonly will see. The patient advised medication, or the patient examined for a chest x-ray. Now, the problem with that is it's not actually the patient who's advising or the patient who's examining. It's the doctor who's doing that action. So in order to convey that with the correct meaning, we have to say the patient was advised, or the patient was examined or was prescribed. And we don't say afterwards by the doctor, but that is the implication there. So some examples there. The patient was advised to increase their exercise. The patient was prescribed acetaminophen. The patient was examined for signs of this disease. So that's how we use it. If the verb is not actually done by the patient, but it's done by the doctor, we need was before the verb with the participle to represent that. Mistake number 3 is not using the present perfect enough. Sometimes we have situations that require that present simple. The patient smokes 20 cigarettes a week. Sometimes we have situations in the past. The patient suffered an injury on March 30th. But what do we do if we're trying to convey that something started in the past and it's continuing until the present, or it might be continuing into the future still? We don't know. We need that present perfect. Present perfect being the has or have plus the participle. So has experienced, has had, for example. Or you can actually use the present perfect progressive. So we would have has or have plus been and then the verb in the ing. Has been experiencing, has been suffering from. Why do we use this? Well, let's take, for example, a situation where the patient has symptoms that have been ongoing for a period of time. They haven't finished, they're still going. We need that present perfect or present perfect progressive to express that. So for example, the patient has been having headaches, or the patient has had fatigue or symptoms of fatigue for 3 months. Or one more, the patient has been experiencing shortness of breath on a weekly basis. Present perfect, we need it to convey that sense of something started in the past, continuing up until the present, and it may continue into the future. Mistake number 4 is incorrectly portraying the patient's history with the wrong tense. What's challenging about this is usually with history we think it's in the past. However, when we're referencing the patient's past medical history, we're actually referencing the current patient who is alive right now. Therefore, when talking about their history, it should be present tense. So for example, the patient has a history of diabetes, or the patient has a family history of asthma. Be careful with that one. History can be a confusing word, but we want it to be in the present tense. Mistake number 5 is reporting tests, labs, exams, results in the wrong tense. So when we're thinking about these tests, they have happened by the time you're reporting those results. So just like talking about when the patient presents to the office, we also want tests and results to be in that past tense. So the results showed, or the tests were conducted, or the tests revealed. We want it past tense because the tests were done, we saw the results, now we're reporting those results. So be careful with that one. Usually tests, labs, exams, results, all of those are reported in that past simple tense there. Or back to that idea of the passive, the tests were conducted and revealed something. They were conducted not by the patient, but by the doctor or the person running those tests. So watch out for those tenses. Those are the top 5 tips. I have one more bonus tip for you.